The Mental Welfare Commission for Scotland protects and promotes the human rights of people with mental illness, learning disabilities, dementia and related conditions. Based in Edinburgh, we work across the country. We are accountable to Scottish ministers and have a number of statutory roles, but we operate as an independent voice. We are governed by a publicly appointed board which sets the strategic direction for the Commission. Board members bring a wealth of experience in using and managing mental health and learning disability services. Our board always includes one person with personal experience of mental illness and one family member or carer. There are 5 different strands to our work. 1 is to influence and empower. Examples include work to ensure that a human rights focus is at the heart of the government's mental health strategy, and our leading role in helping to modernise the law as it affects adults with incapacity. We also try to help empower patients. We were aware that patients are not always told about their rights at different stages of treatment. So we worked with patients, hospital staff and the Scottish Commission for Human Rights to create a set of materials called Rights in Mind, which was shared with wards across the country and is free to any ward that wishes to use this guidance. We visit over 1,000 people across Scotland every year to find out about their experience of care and treatment. We also talk to family, carers and welfare guardians. Some of these are local visits to individual wards or units, or to mental health services in prisons. We publish a report after each of these visits with recommendations for change where we believe improvements are needed. Some of these visits will be to individuals receiving similar care and treatment, for example, all adult acute wards or dementia care. These themed visits allow us to really understand the care and treatment being provided across Scotland. Again, we publish our findings and recommendations. We monitor the use of the Mental Health Act and the Adults with Incapacity Act. We receive paperwork for every person detained under the Mental Health Act and everyone subject to welfare guardianship under the Adults with Incapacity Act. We make this data available to inform service development and national policy and highlight issues which need action. We look in more depth where we have concerns about a particular topic, for example, young people admitted to non-specialist wards. When we have concerns about a person's care and treatment, we seek to make sure they are being addressed. Where our concerns are serious, we can instigate our own investigation. We publish these investigations when we believe the case has implications across Scotland and where it shows serious failings. We provide information and advice to patients and people who use services, to families and to professionals to help ensure that the law is followed and people's rights are upheld. We do this through our good practice guides, our advice line, our website and other routes. As well as seeking improvements elsewhere, we always aim to improve our own efficiency and effectiveness.